Thank you very much, Professor Andrew, for your nice presentation. Distinguished guests, we are proud of your work, and we are writing all together the revolution of surgery. So can you hear my voice clearly? Yes.
Yes, yes.
Yeah, okay. So the avatar surgeon telementoring. We feel proud to tell you our journey, which extends for 15 years in doing telesurgery and telementoring. We were using Skypes before 15 years back in controlling the Da Vinci robots. And also after that, we went to an avatar telementoring using virtual reality. And after the metaverse was introduced, we saw ourselves having the necessary weapons to start with the journey that you will see and the technologies that you will see. So what we did, we put all the technology that we have, the robotic surgery, the telementoring, the virtual reality, and we put it in a hospital, which was made by an metaverse engineer company in USA, and we got our license to open the first metaverse hospital, in which we started to publish our work and to do our real life surgeries and to receive our international patients, and also the Robotic Academy, which we initiated in 2018, and we were able to train 120 surgeons. And from 2022 and 2023, when we started the metaverse, we were able to train more than 50 surgeons about using technologies of the artificial intelligence and metaverse. Yes. So now our lecture today is the avatar surgeon telementoring. What is the avatar definition? The avatar is a character or a creature that you can create to present yourself in a computer game, on the internet, or the virtual world, where people interact together to participate in certain activities and share their experience. And this is very important, and we can see the uses of such technology is not only in gaming when it started, or in Hollywood cinema when, if you remember all the Avatar movie, you will see that it has reached a state in all science like medicine, space, engineering, and more. So the avatar surgeon telementoring, you can see here the instrument that I use in my work as a surgeon, as a surgical oncology and professor of surgery, working in the Canadian hospital in Dubai, and opening the first robotic surgery center in Baghdad, Iraq, and also training the surgeons and doing telementoring of surgery between Dubai and Italy, and Dubai and Japan. We feel proud about our friend that you will talk later on, Professor Michel, that he was our representative in the European Union. So the avatar surgeon telementoring, here, the artificial intelligence, which is the theory of development of computer system that able to give instruction normally requiring a brain of a human. So it is a science of machine that behave and train like a human. So the components of the artificial intelligence is learning, reasoning, problem solving, perception, and language understanding. In the metaverse, it's connection of two words, the meta from the Greek language meaning the more comprehensive or beyond, and the meta, which means and the part of the word the universe, which is the science around or in beyond the universe. The four powers of the metaverse that we are having, which are these four powers actually led us to important science that you will see together. And if we put it for any surgeon doing a surgery, especially complex surgery, he can put it and he can reach an area near perfection, which are the artificial augmented reality, virtual reality, artificial intelligence, 3D reconstruction, and Internet of Things, and the blockchain. We were able to upload the avatars that you will see in surgical operation that we are transferring between countries in all these powers. So we are supplying a science of power to this avatar that is doing surgeries. The virtual reality, which is a fully artificial intelligence and environment, like for our audience who are sitting now in the metaverse hospital. The augmented reality is a virtual object overload on a real environmental world. And the mixed reality is mixing the two environment, the virtual environment combined with the real world. The blockchain is a digital database ledger that is distributed among nodes of peer-to-peer network. And all of you have seen the blockchain and the revolution of a cryptocurrency, the revolution of digital surgery, and the revolution of space exploration because of this amazing information and even the development of artificial intelligence because of the blockchain and the data information which are scattered together and giving to the service needed. So what are the advantages of artificial virtual reality surgery and why a surgeon use these types of camera? And you can see in the market, we are having more than 6 types, like the Apple camera, the HoloLens, the Oculus 3. For me, I started with Oculus camera. And what are the advantages? Number one, gathering expert surgeon in one place to supervise surgery. Number two, for surgeon training. Number three, seeing the surgical field in a 3D dimension to increase the accuracy and success of surgery. And finally, the telesurgery and telementoring in space medicine and beyond. So how we are doing this story? As I told you, to have the weapons that you need, and when you combine together these science, you reach to a state that has never reached before. So what we did, we are like a soul and a body. So we were succeeded to mix the metaverse operative theater with the real operative theater and introduce all these technologies by connecting with the real hospitals, operative theater, with robotic and virtual reality surgery systems to train the surgeons to use these virtual reality and to advance robotic arm controlled from distance by virtual reality. We will see together an experience have done in the Robotic Academy between Dubai and London, how I control the robotic arm wearing the virtual reality cameras and the arm controllers in order to control a robotic arm between Dubai and London to do a surgery or to do a certain task. So what are the advantages of the metaverse hospital and why we are combining the metaverse in it? Number one, reducing the risk of infection. Number two, speed recovery times. Three, global collaboration between surgeons. Four, access anytime, anywhere, saving time and money. Number five, the virtual reality clinics, waiting rooms, and operative theaters. Number six, telemedicine and telesurgery. Seven, the innovative surgical option, artificial intelligence, virtual reality, and robotics. And eight, advanced healthcare services to space and the space exploration mission, like when we will see. Here, sometime I'm giving some workshops, so this is the special that you can reach, and also the hospital. So the global generative of AI in healthcare market, you can see the what we are living and what is the expectation and the increase in this market from 222 up to 232. You can see the increase is up to 17.2 billion US dollar, and it can increase up to 70% investment. And the metaverse market size. So why a surgeon or any famous surgeon or any scientist enter the metaverse? You will see the answer here. The total metaverse market size is reaching in 2030 1.5 billion US dollar. And let us come to a story. I was giving this lecture before 2 years back. The story is Mark Zuckerberg. This is the first time that a businessman in which his fortune doubles 6 times in 1.5 years because of he invested in the metaverse and AI technology. So we are having now a real proof, and also we are having the surgical proof that you will see from my live surgeries. Next slide. You can see that 250 billion global market for virtual reality and augmented reality, up to 28 billion in 2021. It will reach up to 250 billion by 2028 and 5 billion users. So the AI uses for surgery. We can use it in the pre-operative planning and the intra-operative guidance and in the surgical robot that we are using. In the pre-operative requirement, accuracy, automation, privacy, and the speed. And the intraoperative guidance example, the 3D reconstruction, endoscopic navigation, and tissue featuring, and tissue tracking, and augmented reality. And in the surgical robot, you can see the advanced robot that has AI ability, like the Da Vinci 5. You can see that it has an amazing artificial intelligence, and many, like the mid robots from China, who are having an artificial intelligence ability. This is my office and my clinic in Iraq. You can see that we feel proud to introduce all these advanced technologies in the robotic surgery center in Iraq. You can see that even our patient, he was having a pancreatic head tumor. So we showed him a map how we are using the AI technology and the 3D reconstruction and the surgery that is done. We will speak about it. Next slide, please. So this avatar that we are speaking about and who is doing the telementoring is supplied by artificial intelligence. Example, many options of AI we are supplying him, like the ChatGPT, like endoscopes with AI, like radiological devices with AI, and like advanced robotic system with AI, and even controlling the robotic arms from distance. You can see that, of course, when you have an avatar and also you have an endoscope supplied with AI, many surgeons sometimes lose some lesions which are an early cancerous, so the AI can help you to identify the cancerous lesion. In the bariatric surgery, any surgeon who work on bariatric surgery, you can see that even the AI and the 3D reconstruction can help you for revision bariatric surgeries. When you are facing certain problems, they can give you an amazing roadmap to treat. And of course, artificial intelligence in bariatric surgery can be assessed in many manners, like risk assessment, intraoperative, post-operative quality control, and even operative control using advanced robots. So here are some of our live surgeries that I told you about, and we introduced these surgeries in the first artificial intelligence conference in Dubai, supported by the Dubai government. And this is a case of recurrent rectal tumor in which the patient was 77-year-old. So after that, I operated and managed the surgery between Dubai and Baghdad. I sent myself as an avatar to my trained center there, in which this avatar was supplied by the artificial intelligence and the roadmap to treat this case, and the trained team I was having there. And we treated the case by laser ablation, heat ablation, to attack the recurrent tumor in the rectum and the side wall of the pelvis and infected lymph node. And this guidance was done all through the artificial intelligence. The success rate was amazing. This was published in many journals, and also the surgery was a success. Why? Because artificial intelligence and the avatar telementoring was used in this surgery, and we succeeded to save the life of the patient because the patient was unfit for super major surgery. Next slide, please. Is this a video? Yes. Robotic Surgery Academy. Today we are having an important surgery that we used the artificial intelligence, the avatar telementoring supplied with artificial intelligence, the metaverse technologies. The case is a recurrent rectal tumor, and we are using heat ablation therapy. The patient was unfit for other types of procedures, and the artificial intelligence was used and participated in selecting the method of the treatment. We were proud about the audience that will connect, that will join us. Professor Michel Amanda from Italy, Magna Gracia University, Professor Mohanad from King Faisal Hospital. Yes, so you can see here how we introduced the ablation radio frequency, and everything was central, like a tele-war. Everywhere I say that any country now has these advanced technology will win the wars. So any country in wars, if you have the artificial intelligence or the metaverse, can be used in assurance. I want to tell you a very important thing, that these artificial intelligence program that we are using in surgeries are human guided, which means after the artificial intelligence give his decision, an expert surgeon in surgical oncology, example 30 or 25 years expert, will give his decision, and he will guide and give the decision to the family, and discuss personally with the surgeon, with the patient, so that everything will be agreed on and we succeed on. And we feel proud to open an advanced surgery center now in Dubai, UAE, in which that we are receiving a lot of international cases using these advanced technologies. Here is another case, okay, of avatar telementoring with AI in surgical oncology, which is heat ablation for recurrent adrenal tumor. This patient was operated for 3 times, and after that he contacted us, suffering from a mass in the left upper quadrant, which was a recurrent rectal tumor. This mass was attacking the abdominal aorta. There are 2 options: either to do a super major surgery, in which that we will remove the mass and use aortic graft. The patient was unfit for surgery, so this is why we use artificial intelligence and avatar telementoring to use the technology of laser ablation, and also it was a nice success in which that we succeeded to kill more than 70% of this tumor and regress, and the patient now in the recovery time. Also, I sent myself an avatar between Dubai and Baghdad, and I supervised the surgery in every step, and even when this laser is inside the heart of the tumor, I was firing the laser button either from my side or from Baghdad. Next slide, please. You can see here the pancreatic head tumor that we showed together also. If you can see that on your right side is a 4 centimeter pancreatic head tumor, and on your left side is after. This patient was 82-year-old, presented to us with a pancreatic tumor, and also she was unfit for surgery. And again, artificial intelligence, avatar telementoring was used to choose the most suitable option, and laser ablation and the tumor heat ablation was chosen by the artificial intelligence and guided by the human surgeon, Professor Dr. Mohanad Ansari. And after that, we made the treatment. You can see on your left side, this is exactly after about 40 minutes. It took about 45 minutes after the ablation. The tumor regressed. We were able to see even the bubbles of killing the tumor by the heat laser ablation under ultrasound guide and general anesthesia. And we were able to save the life of the patient. The patient is alive on oral regular fluid with monitoring. Okay, next slide, please. So here you can see that even these robotic programs can be controlled also by automation and machine learning. What we did also by the avatar telementoring is in liver transplant. You can see, and all of you know that the liver transplant is a complex procedure that you need an expert team. When we are able to introduce the avatar, the 3D reconstruction, and you know the congenital anomalies of the hepatic veins or the hepatic arteries or the biliary system, we were able to see all this before and to send an avatar expert with all these to tell the surgical team when to use the graft, what to do and when to do, or even to use the advanced robotic systems. And we are working now with the Egyptians to develop their technologies, because they are working on the classic method of liver transplant. Our strategy is to introduce the avatar telementoring and artificial intelligence in liver transplant. Okay, so the avatar, how AI improved the entire radiology workflow also. As I told you, when we are sending these avatar, also these are supplied with programs of radiology. So example, if we are having in the pre-op or intra-operative or post-operative complication, we can use the AI to predict the diagnosis and also to help the expert radiologist in order to give the final decision. And also the endoscope that I told you about, using global refinements and the 3D mapping, 3D registration and endoscopic pose estimation, and local mapping and endoscope pose estimation in order to use assurance. And all this, and after reaching all these advanced technologies, we succeeded to open something in the hospital of the Metaverse Hospital, which is unique and we feel proud of, which is our space telemedicine telesurgery center, in which it was approved by NASA, and we were able to provide the primary healthcare and the primary surgical care for the International Space Station and space exploration mission. And to develop more, we were able to use the Metaverse labs that we have, and by the Metaverse engineers and satellite manufacturing, we were able to develop and to manufacture now the first health satellite that will be launched from USA maybe within the 9 months from now. And you can see on the right side, this is the satellite under manufacturing. The first Earth observation health alarm satellite, designed and developed with the Satellite Manufacture Laboratory Space Academy by Professor Mohanad Ansari and the scientists, the Metaverse Surgical Hospital and the Space Telemedicine Telesurgery Center and the Space Academy, and with the Magna Gracia University, which is the first satellite that has an alarm system with avatar that you will see. So this is the Space Academy, and this is the satellite manufacturing lab. We are having a branch in Dubai now, and in USA, and in Italy, and this is our health satellite. So after succeeding in making this avatar to control surgeries between countries, the program that we are working now with NASA and UAE Space Agency is the avatar-guided satellite, which is called the Space Alarm Avatar Rescue Team, which is an advanced alarm system using satellites GPS programs, and Google Earth to send emergency rescue teams and avatar supplied with artificial intelligence for disaster areas to save lives and properties. So, example, if we are having floods or fires or any super major accidents or earthquakes, the satellite will give an instruction to our space telemedicine telesurgery center, and after that, an auto-activated system using the Google Map will send our avatars and rescue team supplied with the medical aid and with special robots to save life. And this is a system will be implemented in UAE and in USA and also in Portugal. And this is our center sometime that we trained in Iraq. Next slide, please. And here I just want you to see the importance, how we are controlling the robotic arm, as I told you, from the virtual reality and from the metaverse. Yes.
What you see is the cooperation between Extend Robotics and the Robotic Surgery Academy. Dr. Mohanad and Ansari, so what we are doing, we are developing and manufacturing the Galaxy robotic arm. The uses of this arm will be in minimal invasive surgery, the Galaxy robotic surgical system, and also the robotic satellite arm, in which that it has a space exploration mission and also a space telesurgery. What you will see now is a direct control of this robotic arm between Dubai and London, and 100% control by virtual reality arm control. What I will do now, this is example. Okay, now it's activated. Now I'm moving anteriorly about 3 centimeters. I'm now moving posteriorly about 3 centimeters. Now I will go to the left about 3 centimeters. And now I will go to the right about 3 centimeters. The control and the time delay distance and the latency is amazing. And we are using here 4G, and in the way we have the 5G technology. Yes.
Yes, please. And here, this is the Space Telemedicine Telesurgery Center. Here we are making a live providing of healthcare services to the space exploration mission SpaceX, in which we are having our astronauts from UAE, Sultan and Niyad. Video.
From the Robotic Surgery Center Hospital, we've been proud to follow up the space flight mission to the International Space Station, the Dragon by SpaceX. And as you can see that we are able to follow the medical condition of the astronauts inside the craft until the docking from the launch. The technologies that we provide the primary health care and the surgical care for the space missions with the use of the virtual reality, holoportation, and robots. We feel proud about this mission today because it has the astronaut Sultan al-Niyad, the Arabic UAE astronauts, in which it will be the longest trip to space by an Arabic astronaut. We feel proud of Mohammed bin Rashid Space Center and the UAE Space Agency for this achievement, and send congratulations.
Yes. So if you can see that we are supplying now NASA, we are working with the National Space, ISS National Lab, and with NASA. And after we supplied them with these science, this was 1 year back, NASA approved using artificial intelligence, the virtual reality and robotic arms to provide the primary health services. And all of you have seen the telesurgery between the Earth and ISS with the Mira robot. And we feel proud that we were part of the team that our lectures and more than 4 years back giving to NASA about the implementation and the uses of such technology. And such, I will reach an end to my lecture. And of course, we will have we were ready to answer any question after that. And thank you very much. Yes. Yeah.
Thank
so
you,
now,
Mohanad. Thank you, Mohanad. Thank you, Mohanad.
Yes. So now,
yeah, thank you, Mohanad. That was fantastic. That was very interesting. You know, are you able to hear me? I think you are.
Yes, I can hear you, Professor. I can hear
you. You know, I think on the short term, a lot of our listeners and people in the journal and you know, doctors today would be interested in how the metaverse can actually impact their day-to-day services right now. How do you envision the metaverse able to have doctors interact better with their patients? I was looking at your lecture and I was thinking younger people today are probably going to be more and more comfortable interacting with their doctor via a metaverse. And
of course, after the lectures, I will make you an introduction
this is something that we
around in the
can't
hospital, that you will see outpatient clinic, the operative theater, the space center, and all. We are now a real hospital. We are seeing our daily reservation with all specialties, and we are having now international reservations, our receptionist, our insurance department, and so. I feel proud about all this. And also, the Robotic Surgery Academy started to train surgeons and also to give vision like professors like you in order to focus the light on what we are doing. Okay, and also, of course, all of you will be invited on our satellite launch and our services of the alarm system. Many countries now are interested. Okay, so this is a real story of real success, of a real mixing of these science together, robotics, AIs, virtual realities, telementoring, and you can see where we have reached. And now I feel proud that my company, which is called Robotic Space Services, is submitting a program for this primary healthcare and surgical care to the moon base, in which that 12 countries are building this moon base. And when they saw my system, they told me, Professor, your system is ideal to supply the space services for the moon and even for Mars. So this is why I'm sure, as you said, the professor, many scientists and many surgeons, even the professors, the teachers, and even the new generations will be very happy to see all this. We are living a revolution of artificial intelligence and the space era. Yes, and this is the story. Yeah.
So I notice you mentioned that you have an office in Iraq, but you're also located in Dubai, correct?
Yes, dear. I will tell you, I live 18 years in Iraq, in Dubai. Okay, I have my golden visa. My hospital is here. My academy is here. But for me, I wanted to do something for my country. So I feel proud to open my first robotic surgery center there, and also to train the Iraqi surgeons about this advanced technology. And also I operate by telementoring the rare surgeries in surgical oncology and the liver transplant. I trained a lot of teams of surgeons, and after that, I'm monitoring them with an avatar supplied with AI. Between Dubai
are you interacting with them while they're doing surgery? Or
yes.
Yeah, okay. So do you know,
like what Professor Michel will introduce, I will be with them in every step, from A to Z. Even I will tell them where to cut, whether laparoscope or robots. And even I trained a team from Finland to do laser facelift. I will send you on later on. It was an amazing. They were trained in Dubai, and after that, when they done their first surgery, I went to them through avatar between Dubai and Finland to see that everything was going on. So I was able to tell them from where to enter in the face and how to give the laser energy and how to do the facelift using laser, like this.
So I think, you know, what I'm getting at is right now, people who are listening, if they're interested in seeing patients through the metaverse, if they're interested in opening up an office in your metaverse hospital, how would they go about
my clinic is ready for them in any reservation for any patient. And of course, example for me, I'm an expert surgical oncologist. So any patient who come to my office in the clinic, I give them the option. Do you want your surgery by robots or by artificial intelligence guided with lasers or by advanced laparoscopes or by virtual reality or 3D reconstruction or with all? I feel proud to offer all these services to them. Okay. And, whenever you have more complicated cases, you will need to use more weapons. And it's like exactly a soldier who is entering a battle enemy, and he is supplied with satellites, lasers, robots. And this is what Dr. Mohanad is doing. Yes.
No, I understand. I'm trying to get at people who are interested in opening up an office in the metaverse, seeing patients of their own, helping on their own. Is that something that they would have to reach out to you and see how
yes,
to
of
do
course,
that?
I'm ready to give them. I will have two options for them to give them a course of training. I'm having workshops every month. Okay, we can organize a workshop with the AI together and with the International Digestive of Surgery. We are making workshops with the Magna Gracia University and Professor Michel in Italy. So we can
Okay.
train them in a workshop, and after that, they can use the facility of our hospital, or they can open their own metaverse clinic. It's up to them. You must know that Nadal, which is a famous tennis player, he opened his tennis academy. You must know that many scientists opened their work, like engineers or famous lawyers. And the metaverse now is a market, as you showed from my slides. It's an evolving market. You can succeed, you can attract, and you can implement AI with it.
Okay.